The U.S. Inflation Reduction Act is coming into force tomorrow. It will, among other things, cap the price of insulin across the country and reduce the cost of medication. But the act will be kicking in just as the Republican Party regains a majority in the House, potentially putting bills like this at risk. Chris Jones reports from Washington.
Kimberly Kavanagh is no stranger to rationing. She was diagnosed with type 1 diabetes when she was 14. She hasn't always qualified for health insurance and has at times struggled to afford the insulin she needs to live.
It was costing me, for a 30-day supply, between $500 and I would say close to $900 just to refill one prescription. Now I take 2 different types of insulin, so that's going to be close to $1,500 a month. And I was pretty young, so I wasn't making a ton of money.
Insulin prices in the US have risen every year for nearly 2 decades. One vial of Humalog insulin that cost $21 in 1999 now costs around $330, a 1,000% increase. And according to a new study, price hikes like this have led well over 1 million Americans to ration their supply, meaning they take just enough insulin to stay alive, but not enough necessarily to keep them healthy. Kimberly says the practice has left her with long-term health problems.
And it should never be a choice between eating dinner or taking your insulin. I think, with something like diabetes, there is no gray area. It's black and white. You can't live without it, and you have to take it.
The Center for Disease Control and Prevention estimate that more than 37 million Americans now live with diabetes. That number is increasing at an alarming rate as the population ages, so affordable insulin will be crucial in the years ahead. Last summer, President Joe Biden signed the Inflation Reduction Act into law to help tackle that issue. From January 3rd, 3.3 million people with diabetes on one of the government's Medicare plans will see the price of their insulin capped at a maximum cost of $35 per month. And that's not all.
Guess what? We're giving Medicare the power to negotiate those prices now on some drugs. This means seniors are going to pay less for the prescription drugs, while we're changing circumstances for people in Medicare by putting a cap of a maximum of $2,000 a year on their prescription drug costs, no matter what the reason for those prescriptions are.
But there are critics who say the measure doesn't go far enough. It won't help millions of diabetics who are either privately insured or without health insurance altogether. And that power to negotiate drugs prices only comes into effect from 2026. Some fear that that gives drugs manufacturers time to go on the offensive, lobbying industry-friendly Republicans to repeal the law when they regain control of the House in January. But according to Professor Casey Burgett, Legislative Affairs Program Director at George Washington University, that's not likely.
They're going to have control over one chamber, which means they can do things assuming that they can keep all of their votes in line, which cannot be assumed on almost anything. If they get all of those votes to repeal it, then it still has to go through the Senate, which is not in Republican hands, and then it has a Democratic president ready to stamp his veto on his landmark piece of legislation. It's just not politically likely.
Repealing the act would also mean taking away the promise of affordable drugs for millions of Americans, a losing strategy for the Republican Party leading into 2024. Kimberly says although the Inflation Reduction Act has its limitations, she still thinks it's a good step towards ending the wait for affordable drugs across America, ultimately saving thousands of lives. Chris Jones, CNA, Washington.